Let's take you now to Zambia. 800 doctors. Yes, that's a big story. And that number, 800 doctors in Zambia, have actually called on the president to give them a clear roadmap on recruitment of 11,200 health workers, even as unemployed doctors in Lusaka have again staged a protest in a bid to press government to offer them jobs. Meanwhile, the Unemployed Doctors chairperson, Dr. Wallace Ndumba, has expressed concern that police have denied them permission to march to the State House to petition President Hakainde Hichilema.
Recall that last week, the Ministry of Health Permanent Secretary, Technical Services, Professor Laxin Kasonka, told protesting doctors that recruitment process was being handled in a systematic manner that will go in tandem with payroll space. Joining us all the way from Zambia is Doctors Chairperson, Dr. Wallace Ndumba. Many thanks for joining us on the program this morning. And now, looking at the situation of things in Zambia, can you tell us what the people, the doctors, the unemployed doctors, can you tell us what the atmosphere is like for the unemployed doctors right now in Zambia?
Thank you very much. So the atmosphere for the unemployed doctors in Zambia is tense because going back to last year, the new government, following their victory of the August elections, they assured all the unemployed doctors to say before the end of the year 2021, you are all going to be employed. But towards the demise of the year 2021, that position changed. And they said, since January 2022 is just around the corner, we're going to employ you in January 2022. So people waited. And January came, there was nothing that was going on. Just last month, which is February, there was some new information that was communicated to the unemployed doctors who have been waiting for over 2 years now. We were informed to say the government is not going to employ all the unemployed doctors, and that caused stir and anxiety among the affected doctors. That is what led to the protest that you've been seeing.
All right, doctor, now looking at an interview you had in recent times where you announced that no doctor will be given free services as volunteer, especially at the expense of unfulfilled promise by the government. Doesn't this go against the oath that you've taken in your profession, talking about the first call to save life, amongst other things?
Okay, so speaking frankly, you find that doctors, they work in a very dangerous environment. 100 patients, and they are subjected to various elements which are dangerous. So it's not considerate and reasonable that doctors should be offering free services at the expense of being paid. Because if you look at it, the politicians themselves who are spearheading that agenda, they don't volunteer. Why should they force the junior doctors who are just starting up their lives to volunteer? It doesn't add up.
All right. Let's also ask this question now. Seeing that these doctors haven't been employed, and there's also a call for payment to be made, especially when it comes to offering of services. Do you think that this would be sorted anytime soon? Because this is like the obtained time that you're making this request.
Okay, so that is the more reason why the membership or the affected doctors, they decided and resolved to seek the audience of the president, because we came to realize that the ministry is not helping us. So as at now, we can't tell how long the process is going to take for people to get paid. So that's why we want to engage the president so that we can explain to him and probably it can look at the plight of the affected doctors.
All right, Doctor, just before we let you go, we're down to the last minute. You talked about, in an interview, you talked about the government law that concerns you getting a license. Can you expatiate on that and why you would want that law to be changed?
Okay, so basically what it is that when a doctor in Zambia completes his or her studies, they are compelled to only work in a government institution at a designated site. So in a situation where the government does not employ that doctor following completion of their studies, they cannot work anywhere else at a private institution. So we wouldn't want the law to be changed, but we would want the government to put in contingent measures or mitigations so that this crisis that we are being faced with right now is kept.
All right, thank you so much for your input, and we will be following this story closely as it unfolds in Zambia. We wish you the very best in your course. Doctors chairperson, Dr. Wallace Ndumba, many thanks for joining the program once again.
Thank you.